This webinar aims to show you how to use the Public Health England tool Preview to influence your health visiting practice. It is brought to you by the Institute of Health Visiting as part of Making the Most of Health Visiting programme, which is designed to support your continued professional development. Preview resources have been produced to help you as health visitors with your universal preventive work. They offer some conversation starters to engage parents in prevention talk as individuals and in their community, giving you information on what factors in pregnancy and the New Birth Review can tell you about a child's future health, development and behaviour, so you can target your preventive skills and your time more effectively. There are several parts to the Preview resources. There are different conversation starters for you to use with individual families, groups and your team. The Preview background evidence charts show the strength of association between maternal factors when the infant is 9 months and the outcomes for that child when they're aged 5. There is a chart showing the association between maternal factors when the child is aged 3 and the outcomes for that child when they're aged 5. And the third chart shows how certain experiences, whether intermittent or persistent, during a child's early years, impact upon their outcomes for health, behaviour and learning and development. There are 2 conversation starters designed to be used with parents. The first has been produced to help parents to think about their child's future and what as parents they can do to get there. Transition to parenthood is one of life's most significant events, and pregnancy is a time when mothers and fathers are uniquely motivated to think ahead and plan for their unborn child. So using these conversation starters will enable parents to think about and plan their baby's future. Conversation starters are a way of supporting a professional relationship that leads to meaningful preventive work, not just another checklist or assessment tool. Using these conversation starters will support your professional relationship with parents and help them to think about their child's future and what it is they want and how they can achieve this. This conversation starter is designed to be used with a group of local parents to enable them to think about their community and look beyond their traditional services for support. It helps them to think about what the community already provides to support local families and can what's on offer be improved or made more accessible. It helps them to think about what else might be useful and how individuals can get involved themselves. The final conversation starter is designed to support your health visiting team to discuss how Preview information can support you to prioritise your families, to think about what outcomes Preview have looked at and what factors seem to be mostly related to each of these outcomes. It also helps you to think about the theories that underpin preventive work with very young children. As health visitors, we're more likely to support change for parents if our conversations understand and respect the values and priorities of parents. If we're clear that the child's well-being is our highest priority, and if we listen to and reflect back the positive intention of parents. With parents' permission, we should assess their knowledge, their values, priorities, clarifying and offering new information. Find common ground with parents and resist the urge to give unsolicited advice. Agree the priorities with parents for moving forward and think and agree together how this can happen. The following series of charts are a visual representation of the factors at 9 months and at 3 years that are associated with learning and development, health and behaviour outcomes for children at 5 years. They're designed to support professionals to plan which children would benefit most from preventive support early in life. This chart shows a visual representation of the strength of association between maternal factors in the black boxes when the infant is aged 9 months, and the child outcomes for health, behaviour and learning and development when the child is aged 5 years. The width of the line indicates the strength of the association, and the dotted line shows a recur association. So for example, if we take the maternal factor of deprivation when the child is 9 months old, it has a strong impact on learning and development when the child is aged 5, and some impact on poor behaviour when the child is aged 5. You may have noticed that some maternal factors are missing from this chart, such as domestic violence or substance misuse. There is strong evidence to say these factors affect outcomes for children, but the factors were not collected in the study when the data was collected. This chart shows how maternal factors when the child is aged 3 years affects child outcomes for learning and development, behaviour and health when the child is aged 5 years. So for example, you can see that living in poverty when the child is 3 years of age has a strong impact upon health and an impact upon behaviour and a recur association when the child is aged 5 years. Irregular meal times at 3 years can impact upon a child's health and behaviour outcomes at 5 years. This chart shows how certain experiences, whether persistent or episodic, when a child is 9 months or 3 years, impacts on their outcomes for health, behaviour and learning and development at aged 5. As you can see, health is shown by the green ring, behaviour by the pink and learning development by the blue. Again, the width of the ring relates to the strength of the association. So if we look at the intermittent experience of maternal depression when the child is either 9 months or 3 years, we can see there is some impact on learning and development, a stronger impact upon behaviour and upon health. However, when the experience of maternal depression is persistent at both 9 months and 3 years, there is a strong association for all 3 outcomes, for learning and development, for behaviour and for health. Overall, this chart shows that persistent experiences for a child is most strongly associated with poor outcomes for children aged 5 years, especially for behaviour outcomes, but intermittent or episodic experiences makes a significant impact too. It is important that we use the information in preview tools in the right way. Remember, preview risk factors are associations and not causes. So not all children of teenage mothers have poor outcomes. These risk factors can be used for population level planning, but not deciding which individual families to target. Combine this preview evidence and your professional experience with your knowledge of individual families to decide which families to focus upon. Preview is a whole system approach to support allocation of preventive skills and resources where they have the most benefit. Remember, checklists can be unreliable. There is no substitute for good professional judgment. The preview tool can be found on the Data Gateway website. Just type in datagateway.phe.org.uk. Then select the category Child and Maternal Health. Then click on the preview tool here. You will see this screen. Select the area for the Healthy Child Programme team, which includes health visitors, and then either download the conversation starters or charts that you want to view. This webinar is brought to you by the Institute of Health Visiting. Thank you for listening.